Thank you. Let's see, Zoe, hi, welcome. What campus are you from?
Cuyahoga Falls.
Okay, all right, welcome. Allie, Pam, are you from Pensacola? Pamela, can you hear me? Pam, can you hear me?
Yes, ma'am.
Oh, Ariana, hi, how are you?
Good. How are you doing?
Good. What campus are you from?
What is it? I'm sorry.
Campus,
Oh, Centerville.
Centerville. Okay, welcome.
Thank you.
Michelle, how about you? What campus are you from?
Cuyahoga Falls.
Cuyahoga Falls. Wonderful. Shantorius, I have you. Let's see who else. Jayla, welcome. What
Hi,
campus? What campus are you from?
Pensacola.
Pensacola. Okay. Let's see. Just bear with me while I get everybody checked in, please. Jody, hi. Jody, can you hear me?
I can.
Great. What campus are you from?
Pensacola, Florida.
Pensacola. Okay. Let's see. Amelia, did I see? Yeah, there you are. Is it?
Hello.
Hi, Amelia. What campus are you from?
Cuyahoga Falls, Ohio.
Okay,
Fortis.
great. Great, great. Okay, let me make sure I have, let's see. Jalicia? Kiara, welcome. What campus are you from?
Hi, I'm from the Pensacola Fortis campus.
Pensacola. Okay, thank you. Okay. Alicia, can you hear me? Sierra or Sierra? Sierra. I know I
Yes,
saw you.
ma'am.
There you are. Welcome. What campus are you from?
Pensacola.
Pensacola. A lot of Pensacola students. Pamela, can you hear me yet? Pamela Hodges?
Yes, ma'am, I can now.
Okay, good. Are you from Pensacola?
Yes, ma'am.
And then who else? Did I see Twana?
Yes, ma'am.
Hi, welcome.
Hi.
Hi,
Thank you.
what campus are you from?
Pensacola.
Pensacola, okay. And then Geraldine, did I say that right?
You did, ma'am. Thank you.
Where? Okay,
Pensacola.
oh, there you are, there you are. What campus are you from, Pensacola?
Yes.
Okay. All right, I think, Jalicia, can you hear me?
Uh-huh.
Okay, good. Campus?
Pensacola.
Great, great, thanks. And then the only student we're missing is Danielle Savage. Anybody know a teammate or classmate of Danielle? Okay,
Did you get my name, Professor?
I did. Yeah, welcome. Welcome
Thanks.
to everybody. Let's see. How's everybody doing today? Day one. And you have a Monday class. Are most of you also taking peds and med surge?
Yes,
Okay, all right.
Yeah.
When is your peds class?
Yes.
Or when's your peds class?
8 o'clock this morning.
Yeah.
Oh, so Monday morning, okay.
I
Most
hope
of you,
it falls on, I believe we on
Friday.
Friday,
okay, Friday, okay. What about med surge?
Medicine,
Wednesday,
Wednesday.
Wednesday.
Okay, all right. Okay,
Pensacola campus got Tuesday.
Tuesday, awesome, thank you. I'm trying to plan exam reviews. This term, I want to make sure I understand what everybody's schedule is, so that when we plan our review sessions for the exam reviews, we can try and be as accommodating as possible for you guys. I realize this is a really, really, really busy term. I am Professor Marvel. You're going to be your professor for this community class. I always like to ask right off the bat, what have you heard about this class? When you can be honest, my feelings won't be hurt. What have you
Don't
heard?
sleep on this class. That's all I heard. Don't sleep on this class.
Don't do it.
Yeah, somebody told us in our last class that it was kind of challenging for her. I didn't even know it had a HESI, so.
Okay, so don't sleep on this class, meaning, does that mean like pay attention and stay
Yeah,
on
like-
top of it?
Yes, yes.
Okay, what else have you heard? Come on. That's it?
I think some of us were so whipped on med surg and stuff, we didn't even get to ask these type of questions.
Right? That part's here, that
Yeah.
part.
My only thing is just
extremely
saying,
hard.
yeah, it's just the studying technique. I mean, this is
And
my first
time management
professor.
studying.
Yeah, having you as a teacher, don't know how you test, you get some teachers to kind of help us out with study guides or points to zoom in on, or,
Mhm.
you got some that don't. So I guess it kind of helps you to tell us what type of teacher you are.
Well, I consider myself, let's see, very flexible where I can be. The one thing I ask, number one is communication. Okay, if I don't know what's going on and you're struggling, I can't help you. Okay, that's the one thing that is absolutely primary for me is communication. And if you think about it, in your nursing career, communication is right at the top as well. So I'm willing to, I think I'm pretty laid back. My goal is to get everybody over the finish line here with this class. We do it as a team. I have my job, you have your job. So between the two of us, all of us as a big group, we got to help each other. Everybody gets over the finish line. And it looks like I have lots of Pensacola students. So group study, group preparing for exams. I don't know how you guys function as a group from Pensacola, but I always encourage students from similar campuses to, when you're on campus, to set up some study groups and everybody help each other out. Okay. This isn't a hard class. It really isn't. Okay. It's a different class. Okay. It's different. We have to think differently. Okay. This is nursing in the community. This is public health nursing. Okay, so we have to step aside from what do you think why do you think this class is offered at the end of your program? Because you guys just have one more term left, right? After this, why is this class offered towards the end?
I was kind of thinking that just kind of help us to work with what different cultural people, or from people, maybe people from the outside and the inside, people that may not be exactly like us. to maybe work with our communication skills to, tighten up the language or the relationships between nursing staff and the
Okay,
patients.
that's part of it.
I was thinking that it's more like, help us wrap it all together. Like instead
Ah,
of it being a separation,
bingo.
peds and maternity, it's like basically like you working or you being in a setting where a physician I can't think of the name of it,
Mhm.
but they see all patients. It's not
Yep.
just one specialty.
That's exactly right. Just excuse me for 1 second. Jerry Lynn and Lakeisha, I need you to turn your cameras on, please. That you hit the nail on the head. So think about it. What happens when patients get discharged from the hospital or a long-term care facility and they need care in the home? What are we pulling together? In community nursing, you're taking care of clients across the entire lifespan. Maybe from newborns all the way to the elderly. Okay, so what skills do you need? You need your fundamentals. You definitely need your med-surg. Communication. This is a very med-surg focused course. Because think about, you're caring for clients instead of the hospital, you're caring for them in their home. Okay, so think about, you need all your skills. Actually, if you work on let's say a peds unit, you have your peds skills. If you work on a geriatric unit, geriatrics, in the community, you need all those skills. You need your whole toolbox because you could be taking care of anybody and everybody, from newborns to children to adolescents to adults, vulnerable populations in the community, the homeless, substance abuse, teen pregnancy. So think about it, your fundamentals, your pharmacology. You need to mute. You need your peds experience, your maternity experience, your med-surg experience, your fundamentals, your pharmacology, right? That's why this class is offered towards the end of your program, is because we have to pull all our learning together. There's not going to be a whole lot of new learning in this class as far as skill set. We're just thinking outside the box and moving our care from the inpatient setting to the home setting, to the community setting. Okay, so that's what I want you to think about when you come to class. Take off all those hats. Take off your peds and med-surg. Take off those clinical hats. Take off your current job wherever you work. Take off that hat. Okay, and think community. Okay, what kinds of roles do you think nurses may have in the community? I'll start. I just retired from school nursing. I was a school nurse for over 20 years. Worked in a big district in Colorado and covered numerous schools from preschool all the way up to high school. Okay, school nursing is considered community nursing. We're working in the community. What other types of nursing do you think roles are in the community?
The VA
VA nursing, you bet.
or the military.
Yeah. Corrections nurses? What about hospice nurses?
I was gonna say, what about the nurses that do the urgent care? Is that like
Urgent
you?
care? What about home health?
I was just gonna say, yeah, home health.
What about occupational health? Occupational nursing? We'll get to that in one of our weeks. Occupational nursing is all about the workplace. So what about immunization nurse?
Will athletics be one? I know they said after that last incident, the last
Mhm.
football season, they want to add nurses to the football field now.
We're working in the community. Let's see what else we'll cover. Home health, hospice, school nursing, occupational health nursing, correctional nursing. These are all roles. If you end up going into community nursing, public health, that's what you're going to be doing. Right. So community nursing is very self-directed. Okay, you are out there, you know, when you're in a hospital taking care of patients, you have a whole support team right around you. Right? Well, it's different in the community. You're kind of out there on your own. Of course, you have your resources for sure, but you're doing the home visits by yourself. Okay. So that's the way I want you to think, is you think about taking from inpatient to the home. If you can have that mindset from the beginning of just shifting where we're taking care of the patient or client, then you'll be okay. This class is not a hard class. I actually think it's an interesting class. I always love reading my evaluations at the end of the term. And yesterday I read my evaluations once again. And there were several comments, this bit from particular last term, is they enjoyed the different setting that we're talking about. We're out of the hospital. We're out. We're now in the community. Think about it. Think about your own community. Do you guys know what goes on in your own community? Do you know about all the nursing roles in your own community? Who takes care of these clients? It's the community nurses, right? Public health nurses. So this class is simply learning the mindset of shifting the care from the inpatient setting into the community setting. It's that simple, right? You're gonna do let's say you're doing a home health visit for wound care, wound dressing changes. The same procedure applies whether it's in the hospital or in the home. Does that make sense? Same with IV antibiotics or discharge or teaching. Community nursing is heavily focused on teaching. I mean, as nurses, we teach all the time, but it's really heavily focused in the community. What else can I say as an introduction, not to frighten you? It's not a hard class. Okay. You just got to keep up. Okay. It's 2 credits, and the work associated with this class is 2 credits. So what I always tell my students at the beginning is just carve out a little bit of time each week to get your community work done, and then go focus on med-surg and peds. Okay. Okay, so let me repeat that. Carve out a little bit of time. This is not a heavy workload class. It really isn't. And like somebody said at the beginning, don't sleep on this class. Don't sleep on this class. You need this class to pass.
So I got a question.
Hmm.
I'm one that like to have a book in my hand. Is our book online, or are we using books that we already have already? Because I
We are
know
using 3 books that you already have already. Your
Okay.
fundamentals book. Look, we'll go through that in the syllabus. You have your
Okay.
fundamentals book, your med-surg book, and your intro to peds and maternity.
Oh,
Are we gonna get PowerPoints? I think I emailed you that.
Yeah, so this class is pretty chopped up as far as all the different books. So if we have full chapters in a book, and I don't know if you've looked at your syllabus yet, but there's many reading assignments that are like chapter 6 of the med-surg book, pages 2 to 4. So I don't want to send you a whole PowerPoint of that whole chapter if you're only responsible for 3 pages. Does that make sense? Otherwise, it's going to get really overwhelming, right? So what I've done with past terms, like this term, this week, I think there's 2 full chapters. I'm happy to send you those PowerPoints to those full chapters. But as far as the broken up chapters where there's certain pages, I'm just hesitant to send you the whole PowerPoint because you're not responsible for all of the information in that entire chapter. Does that make sense? What we do send every week that I think is really helpful is, we're next gen focused now, right? So next gen comes with, it's called a blueprint. Okay, we have a blueprint of concepts that we cover. in this class. Blueprint for week one, and it's in your module. So for example, where are my notes? For example, this week, our
Mhm.
concepts we're covering is Introduction to Community Nursing, Levels of Prevention, Healthy People 2030, and Introduction to Vulnerability. If you look at the blueprint concept handout I sent you in your announcement, that's exactly, they're kind of notes. It's kind of a summary. And I use those a lot during my lecture because for you, it's just, those are the 4 topics we want to cover this week. Does that make sense? So you'll get a blueprint every week with the topics that are covered, and it matches your syllabus. You look at week 1, it matches your syllabus. What your blueprint notes for week 2 will match your topics for week 2. It's really, I've tried really hard to organize it, to make it really easy to follow. Okay, so does that answer your question about PowerPoints? I just don't want to bombard you with a lot of information. You know, between your readings, between the blueprint concept handout that I send you, and lecture, that's three excellent resources for you to get the information you need. Does that answer
Yeah,
your
I had
question?
looked at those, the blueprint and the for the concept. That okay. I like those.
Yeah. They used to be just notes. I kind of redid it this term because I wanted to match the blueprint for the course. I'm just using different language, but we all know that this is next gen focused, right? What's next gen about? What's critical thinking, right? Taking your critical knowledge that you've learned through your program, critically thinking about that knowledge, and the last step, which is next gen focus, is application. It's fine to memorize and know and have all the knowledge, but what happens if you can't use that knowledge in practice? There's one of the reasons that we've gone to a next gen format is over the last several years, they've found that research has found that nurses, you graduate from your nursing school, right? You're full of knowledge, but once you get into your practice setting, you're not practice ready. Does that make sense? And that's across the board. So that's what this new next gen focus is, taking your critical knowledge and making sure you can apply it. Okay. I'm trying to just talk you down. I don't want you to worry about this class. Okay. I want you to sit back and enjoy it. Okay. It's a different way of thinking, community nursing. Get out of the clinical setting for right now. Get your head out of that clinical setting. And then what you're going to do this week, there's only 2 discussion questions, which is great. It's weeks 1 and weeks 2. But one of the topics, we talk about the whole term is vulnerable populations. Excuse me, I'm still getting over pneumonia. Think about your community. About all the vulnerable populations in the community you may be caring for. Just think of your own zip code. And this week's discussion question asks you to identify a vulnerable population in your community. Okay. What kinds of what's a vulnerable population in the community?
Elderly, children,
Homeless, teen pregnancy,
Mental health, substance abuse, victims of violence, human trafficking victims. There's lots of vulnerable populations in our communities, lots. So here's what I want to cover today. I want to go through the orientation PowerPoint, which we have to, and you may have already gone over it. Some of you that had med surge this morning, you probably already saw it, most of it, but I need to go through it again. But a lot of you probably have not seen it. And then I'd like to jump to the syllabus, go through the syllabus, and then go through the modules. Not all of them, but just kind of go through how to kind of walk you through. I have attached, since we're not covering content this week, we're doing the orientation, I've attached a recording. That should be in your, and we'll go through the announcements too. There's a recording of this week's content. Did you all see that in your announcement? Okay, so that's this week's content. And then next week we'll move on to our next topics. Okay, but let's cover the PowerPoint first, and then we'll cover the specifics for class. Does anybody have any burning questions they want to get out of the way now? I have a couple of requests. If you are a repeat or a re-entry student, could you just please shoot me an email? Okay, so I can reach out to you and we can talk about how best to support getting you through this term. And that actually goes for everybody. Okay. Thank you to everybody that you all completed your syllabus and technology quizzes. So I appreciate that. I already got your campuses. Have you guys got emails about signing up for CJ Sim? Do you know what I'm talking about? Oh, good. Okay. That needs to happen. Okay. So if you haven't done that yet, everybody should, when I went through my training last week, I was told that every student got an invitation to join. So I just put that in your to-do list this week. Okay, because our HESI case studies, we have 2 of them, are now CJ Sim case studies. They come from Nurse Think. Okay, and so you have to have an account. And I went through training last week, and there's some great exercises and activities for CJ Sim for community that I do want to use. But when we use them during class, you have to be able to have an account. All right, so get that done. Get yourself signed up. Okay, the other thing to do this week, if you don't mind, is just jump into ExamSoft and make sure your account is active. Make sure everything's okay. It probably is. I know we don't have our first exam till week 4, but just go in there this week and make sure everything is set up correctly. All right. Okay, I'm going to jump to the PowerPoint. Anybody have any questions? Have I talked you down a little bit? Seriously, just keep up. It's carve out, block of time, get it done. You guys are a Monday class, so get it, carve out a couple hours over the weekend, get it done, and then you can focus the rest of the week after your class today on Mondays for med surg and peds.
What if
Boom.
you're having trouble
Done.
logging into the CJ?
What?
What if you're having trouble logging into the CJ on SIM?
Then you need to reach out to, was there a resource in your email? If you're having problems, can somebody look? Excuse me.
Are you using the, it's a password 1234?
Yes, I
It's
used
the
it, but
initial
it still,
password?
yes, but it still didn't. It
Oh,
still
okay.
didn't work.
Not for sure then.
Geraldine, I can't quite see you. Is your background blurred? Just a big fog screen. Geraldine.
I can't see anybody having some technical
Okay.
issues with my system. So I'm gonna go back out again and try to come
Okay.
back in.
Okay.
I'm sorry, I
No,
apologize.
no. That's okay.
Okay.
Lakeisha, did you just ask that question about having trouble signing in?
Yes.
So is there a resource in the email that if you're having problems to contact? I'm
It's a
asking
phone
anybody.
number.
There is a phone number? I haven't seen the
Yes,
email. I was
ma'am.
just told that you all got, I mean, I got an introduction email to sign up to. It had a temporary password. And then you go in and change it to your own password.
Yes, ma'am. I'll try from the computer. Maybe it's just because I'm doing it from my phone.
Oh, yeah, yeah, yeah. Oh, there you go, Jayla. Lakeisha, write that phone number down. Did you see it?
Okay. Yes, ma'am.
Okay, great. All right.
Thank you.
You're welcome. All right, let's jump to the PowerPoint. All right. Here we go. Everybody see my screen? Yes? No? Yes, no?
Yes.
Okay,
Yes,
okay, good. All right. All right. What is online what's online learning? We all know what this is, right? You guys have been doing this your whole program. All right. Just have a quick look at this. Your 6 bullets. And I've also I've sent you a copy of this PowerPoint, right? So you have for your reference. I mean, it's just like it's like going to on a ground class, except it's online. Okay. As far as who to contact, this is an important slide. Okay, slide 3. Okay. If you have concerns, first of all, let's start at the top. Okay. If you have any computer access, course questions, grading concerns, start with me, your instructor. Okay. And you have my contact information in several places. You have it in my instructor profile, right, which I set up over the weekend. You have it in a couple of announcements, my contact information. Okay. If you have issues with your sims, your labs, your clinicals, those are campus questions. Okay. You need to reach out to your campus dean or your campus instructor. Okay. If I can't help you solve your problem, then we go to the course lead for this, and that's me. So I will then go to Dean Brown. Okay, if I can't help solve your problem, if you have issues, we can go to Dean Brown together. And here on slide 3 is my email address, kmarvel@fortiscollege.edu. And then I've also, this is Dean Brown's contact number, contact email, contact number. All right, so maybe save this slide. It has important information on there. Okay. So just to reiterate, first contact is me, right? I'm available by email, Canvas, phone. You've got my phone number and my instructor set up. You can text me, you can call me, just identify who you are and what class you're, I've got 4 sections. So just tell me out, hey, I'm a Monday student and can you give me a call? Okay, and put your name in there. Okay. I have no problem. I won't answer texts in the middle of the night, but one of the things that I pride myself on is response time to students. I get my emails to my phone. I have Canvas on my phone, so I periodically check that if I'm not near my computer during the day. Okay, so I'm really good at returning phone, texts, emails. Okay, hopefully through the term, I can suggest ways you can improve your performance. I really would like to get together with the reentry and repeat students so we can come up with a success plan for this course. Since you are repeating it, anybody else would like to set up any kind of a meeting to just talk about a success plan? I'm more than happy to meet with anybody. Okay, that's the other thing is availability. I'm really flexible. I really enjoy meeting with students one-on-one. Love to. So if anybody wants to get together, if I'm at my computer, we can set up a Zoom in a minute. Doesn't, Kate, can you jump on Zoom? Sure. If I'm sitting at my computer working, yes, of course we can jump on Zoom. So I really like my one-on-one meetings with student or contact or conversations. Really enjoy those. As you saw, if you read in my biography, my experience for community nursing is my last 20 plus years in school health. And not a school health, public health, lots of experience in community nursing. Okay, so I'm very confident teaching this class. This is I'm in the middle of my 3rd year. I also, up until this term, have been teaching the RN program as well. This term, I ended up coming to PN full-time with 4 sections. So I don't have any RN sections this term. So anyway, I sent you a email early on about etiquette. So just to review, state your thoughts in a courteous, positive, respectful manner. Be mindful how you express humorous or emotional statements. Okay, sometimes they can be misinterpreted. Keep your comments relevant to the discussion topic. Yeah, that's true, but I love open discussions and interactions between students. So be considerate of others' experiences, feelings, and perspectives. Use proper language. Do not type your messages in all caps, because that means you're yelling. Okay. Okay. This attendance is kind of a big deal the last 3 terms, all right? Everybody knows it's kind of a big deal. So let's just review it here. Okay, you guys are expected to be at this class on Monday at 3 p.m. Eastern time. Okay, there's no more of the, hey, I can't make it to class on Monday. Can I come to your Friday section? There's no more of that. Unless, of course, there's an emergency. Okay, and remember, if you have emergencies with you, your kids, your family members, please get some documentation. If you're going to miss class and you're going to attend another class, I do have to mark you absent. However, we send all of our documentation to Dean Brown, so that, let's say you missed the class today for an emergency and you have a note for it, whether it's your kid or you, even though you're marked absent, it won't go against you if you have documentation. Does that make sense? But you have to be marked absent. So you have to attend today's class. And Dean Brown put a message in your announcements about class changes. If you have any issues with the time and day of this class, I believe she gave you a deadline of Friday, I think. This Friday, you have to reach out to her by this Friday. Okay, so they're mandatory classes, right? Just like your campus classes, right? We do discussion questions. You do one group project on an infectious disease, particular infectious disease. It's due, I think, in week 7. And so I assign you groups in weeks 3 or 4, so you can start working on it. It's just a group activity. I assign you an infectious disease. You talk about what it is and how it's transmitted, how it's treated. Anyway, more to come on that, but we'll do discussion questions. Like I said, you have 2 discussion questions. They're at the beginning of the term, weeks 1 and 2. Projects, you have a paper. Your paper is your vulnerable populations paper. We'll go through that when we get to the modules. It's actually a PowerPoint. Case studies are now CJ Sim. We're not using case studies. We're not using HESI case studies anymore. So that right here, case studies should be CJ Sim activities. Quizzes or exams. All right. So we have 5 quizzes. We'll go through that in the module. Quizzes are taken during class. Okay. Quizzes are taken in this class weeks 2, 3, 5, 6, and 8. You have to be present in class to take your quiz. All right, you can't take it before, you can't take it after. That's why I haven't opened any of the quizzes. I'll open them when we start class. We'll go through our content and then we'll take the quiz. Okay, but you have to be present. You guys know about discussion board posts, right? Your initial post is due on Wednesday. So this Wednesday and next Wednesday, you have due dates. Right? Your initial post for discussion 1 is due this Wednesday and discussion 2 is next Wednesday. And then you have till Sunday to do peer responses. Okay. I've already put in all the due dates in the syllabus or in your assignments. And I have opened it up just the week before. I've had some issues in the last couple of terms about students, even though I encourage them, don't work ahead. I just would prefer that you get what you need to get done for that week. All right, and then be done, and then it will open up again next Monday. Late work. What's the late work policy? You guys tell me, even though you're looking at it. What is it?
Between what, after 7 days, you're gonna get 10% deducted, and any more than 8 days, you get a 0.
Yep. So you know what? Just get your work turned in on time in this class. All right, just turn it in. And then you're not trying to figure out what you need to turn in during the 1 to 7 days. Just get it turned in. All right. It's due, other than these 2 Wednesdays, everything else is due on Sunday. I just get it turned in Sunday night. All right. I always look on Monday mornings to see who hasn't completed it. And then I shoot you an email and say, okay, now we're in the late period. You've got till next Sunday to turn it in, but it'll be a 10% deduction. Now, if you're having issues or there's something going on that's preventing you from being successful, or it's going to be late, reach out to me and let me know. Okay. I've had a sick kid all weekend. Whatever. Let me know. I can work with you. There are certain things I can be flexible with, and there's certain things I can't. But if you communicate with me what's going on, I'm happy to work with you. Okay. So just get it turned in on time, and then we don't have to talk about late work. Okay, attendance. We all get this, right? Everybody needs to show up before 3 o'clock. Okay, don't show up after, because we get a report right after the class. And if you come in at 3:01, you have to be marked late. Believe it or not. And you can't fudge that, because it's an official report that comes from Zoom that we have to submit after every class. Make sense? So I know 3:01 seems ridiculous, but you're late. All right. I think everybody got in here on time today. So you know what? This is 2 hours on Monday. Just be on time. And then we don't have to mess with anything, because being tardy and missing class is going to add up quickly. Add up really quickly. Okay. So attendance will only be recorded during your assigned live session time. Attendance is taken by the instructor during the live session. So make sure you're signing in with your full names, be on camera the whole time. You can't be in your car, even as a passenger. You can't be pulled over in a parking lot. Okay, because I have to remove you from the session. It's crystal clear. Don't be in your car. All right. Stay on camera. You know, I don't want to keep asking for you to turn your camera on. Just stay, you know, it's like being in a ground class. Okay. Attendance missed is in 15-minute increments. So if you come in at 3:01, that's 15 minutes against you. If you come in at 3:16, that's a half an hour. Okay. And then you guys know the 14-day rule, right? If you miss 2 weeks, you're dropped. Okay. Okay. Attendance is taken daily in class by the instructor, turned in over to the registrar by the end of class. So early departures, tardies, and class cuts are recorded in 15-minute increments. Students with chronic absenteeism in excess of 20% of the scheduled hours, either fail or they reduce a whole letter grade. Okay, so just like I said, again, we don't need to have these issues. Just come to class. Okay, have a review of this slide 10, right? You're going to start getting letters. I can tell you if you miss a class, it's like 8.33%. So you're going to get your 5% letter. Okay, so Dean Brown sends out 5% letters, 10%, 15, and then 20. Okay, so if you get a 5% letter, and if you're tardy, that will add up quick. Okay, you're going to get a 5% communication, you're going to get a 10%, you're going to get a 15. And then if we're at 15 or 20, we're going to be sitting down with you, Dean Brown, and your campus dean. Figure out what's going on. Let's not go there. Okay, let's come to class. You should already be doing these 7 steps. You're almost at the end of the program. Review your work that's due each week, complete the reading, and there is not a lot of reading for this class. There really isn't. And it's from books you've already been using. Okay, attend live weekly sessions and use your rubrics. Okay, that's how I grade. Your discussion questions, use your rubrics. All your assignments, use your rubrics. Okay. Anybody have any questions so far? To be successful, keep in contact. That's the most important thing, communication. Have reliable internet. What I tell students, if they don't have a reliable internet, just go to campus. Go to campus and listen and participate in class. Or if you don't have a reliable internet and exams are coming up, plan to go to campus to take your exams. Okay. Try and identify, if you're at home, identify a quiet place from distractions. Read all assignments carefully. Okay. Log into class 4 to 5 times a week. I use my announcements like at the beginning in the first 3-4 weeks. I'm sending announcements out all the time. So log in. And do you guys get alerted when I post an announcement? Okay. It's really kind of my newsletter to you. Okay. Submit all assignments when they're due. Do not procrastinate. No need to procrastinate in this class. You guys all have day 1, right? You all have, I know you've all logged into this class and spent a little bit of time in there because I can see that from everybody. You've done your quizzes. If you're going to print things, I would certainly suggest printing the syllabus. Okay. Come to class prepared to discuss the concepts. It would be extremely helpful if this is a Monday class, if you just read through the blueprint handout that I send, just review your reading and just have an idea. The one thing that drives me nuts is at the beginning of class, I said, so what are we covering today? You know, if you haven't prepared at all, you have no clue what we're covering. And that's the other thing too, is if you haven't prepared at all for class, then all the information we talk about is brand new. Where if you've prepared a little bit, you're at least aware of the topics we're going to be covering. Okay. Come to class prepared, discuss, attend review sessions offered by faculty. So we'll have exam reviews, which I'll talk about in a minute. Meet with the faculty. Meet with the faculty to discuss difficult concepts during office hours. You all got my syllabus cover sheet. I always schedule my office hour the hour before class. Oh, there's Danielle. I always, yeah, the hour before. And so let me know if you want to get together during that hour before class. I don't sit in there in the waiting room. Just let me know. And that's the other thing about my flexibility is I'm available to meet with you guys whenever. I really am. You know, in the mornings, in the evenings, on the weekends. If you're struggling, you got to reach out to me. Okay, you can schedule tutoring sessions. You can do whatever you want. Whatever you want. I'm here to support you and passing this class. Okay, review weekly sessions. You know, if you're not paying attention or you feel like you need to review, you'll get a recording after every week. Go in and review the recording. Okay. Well, let's see. Tutoring. Tutoring, we talked about attendance. Okay. Here's your breakdown. This is in your syllabus. I put it in from your syllabus. You're going to have your KGAs, right? Your key graded assessments. You're going to have 3 exams, 1 HESI, and 5 quizzes. Okay, your 3 exams are 55%. Your quizzes are that other 5% to get up to 60, right? And then your HESI is 20. That's 80. Okay, and then you have 4 projects, assignments that are worth 5% each. You have your NCLEX questions, which there's 4 sets. Your community research project is your vulnerable populations project. Your HESI prep assignment, which we'll talk about, and then your case studies. Okay, so that's how we get to 100%. Everybody knows the 80-20 rule, right? You got to be where? You got to be to 78% at the end of your HESI, your quizzes, your HESI, and your exams. You have to be at a 78 before the last 20% kicks in, right? Okay, any questions about that? That's the same term after term. Let's see what, right around week 6, I'll turn on homework grades so that you can see how your homework is impacting your overall grade. Okay, everybody knows what that looks like, right? You get to see if it's increasing or decreasing. If you're having issues with homework, which you shouldn't be in this class at all, it's not that much, then it's going to bring your grade down. I had a couple of homework fails last term and I hadn't had any in a while and I was really disappointed. You work all term, right? You pass with above a 78 and then your homework was missing and you failed. This should not be a homework fail. Well, no class should be a homework fail, but nope. I do stay on you, by the way. I stay on everybody about homework. So week 6, I will turn on the homework grades. Week 8, I'll turn them off. And then it will stay off. So it's on for like week 6 and 7. You all know this. You need your passing grade of 78 before anything kicks in. Quizzes are part of a KGA. That's why you have to be in class to take it. They have to be proctored, just like an exam. Okay, they are designed to be given at the beginning of class to allow me insight as to concepts students are struggling on. What I'd like to do, and I've talked to the other professors, is at least maybe the first 2 quizzes, maybe due after the content has been provided, but the last 3 quizzes, I really would like to move towards doing them at the beginning of class to see how prepared you are. Right? I don't like it when students fall back into the, well, she's gonna provide all the content. We'll take the quiz after that. You got to do some prep work. Okay. There's only 1 attempt for the quiz. Quizzes are timed at 15 minutes for 10 questions. So we'll do that during class. Exams. Everybody knows the exam routine, right? We have exams on weeks 4, 7, and 10. Okay. So let's see, exams will be given through ExamSoft. Log into your begin exam. Oh, if anybody, speaking of exams, if anybody has previous accommodations They don't necessarily carry over term to term. They may, but you have to submit to me the paperwork for your accommodation so I can submit it to Dean Brown. Okay, so any accommodations would be great. Exams, what else do we want to talk about? Right, you have to take your exam during this class time. There's no more, hey, you know, I worked 2 nights in a row. Can I take it with your Friday section? No. You're expected to take the exam on Mondays at this time. Okay, so again, accommodations, let me know about. If you guys want to take exams on campus with a proctor, I'm okay with that. I'm okay with that. You just need to let me know. You know, at least give me a couple of days notice so I can reach out to that proctor and your dean and make sure everything's set up. They would need the passcode to get in. So it takes a little bit of coordination. Okay, so I have no problem with students taking exams on campus with proctors, but you just have to communicate that to me. Okay. You know about being proctored, show your ID to me. That's all you guys know this. Missed exams, okay? If you're a no-show for the exam, it's a 0. But if for some reason you have missed exams without prior notice, is a 0. If you have an exam that if you miss an exam for personal reasons, okay, after notifying me, you can take the exam up to a week later for 10% for a 10% deduction. Okay, but if you miss an exam due to an emergency, then it requires documentation. Like I said, we send it to Dean Brown. But you got to let me know ahead of time. It says notification must occur within 24 hours if possible. If it's same day or something's just happened, I'll work with you. But the most important thing is you get documentation. So how about this? How about this rule? If you plan on missing class, if you plan on missing a quiz, which means you're not in class, if you plan on missing an exam or you're having issues, just plan on getting documentation because that's what I'm going to ask for. Make sense? Okay. Again, contact me before the exam. I can't do anything after the exam. If you do poorly in the exam and you call me and say, well, you know, I had an emergency, I was up all night with the kids, I can't do anything after you've taken the exam. All right. Homework. What do we want to talk about homework? I hope you're planning. I hope you're planning, prioritizing, completing work and submitting it. I hope you have some kind of an organizational method. Okay, I use a calendar on my phone. Everybody's got their, I mean, at this point, this is actually, you know what, you guys, this is a tough term. There's no question about it. This is a busy and tough term. Your other 2 classes have clinicals. You got 3 classes, 2 sets of clinicals. This doesn't have any clinicals or sims or labs. So this is a busy term. We already talked about late work. NCLEX. Everybody knows how to access NCLEX, right? Do it through, access all your assignments through your shell. Okay, NCLEX, we already give you the topics that you have to select in the categories. So nothing's different from NCLEX. Okay. Oh, I will say something about NCLEX. If you turn in to me something below 40 in the 30s, I'm going to send you a message back and say, listen, if you're in the 30s, I don't think you've learned a whole lot from the assignment. Really, right? You know, you can take NCLEX as much as you want, right? You can only submit it once, but you can take it 10 times. And the reason why I encourage you to submit in the high 40s or 50 is because every time you take it, it will give you rationales. What you got wrong, why you got it wrong, what the correct answer is. And then retake it and keep retaking it until you're in the upper 40s or 50. and then submit that. Because NCLEX, they're worth 1.25%. You know, so if you submit a 20 or 30, number one, that goes against you for the lower grade. But number two, it tells me you probably didn't learn a lot from that NCLEX. All right, so try and submit high NCLEXs, okay? Because that means you've gone through and understood what you got wrong and why you got it wrong. Does that make sense? Don't submit me 20s and 30s, because that tells me you didn't learn anything. Don't send me any screenshots for NCLEX, okay? I need the PDF, the full 15, 16 page, all the categories, because I have to go through and double check you did the right categories. So don't send me a screenshot. And the other thing is, it's a one and done as far, or I need 50 questions together. I can't have 5 10s or 2 25s. I need a full 50 questions. Okay. And the reason that is because it gives you the full experience of all the categories you've selected. If you chop it up into 25s and 10s, you don't get that. Okay. Okay. I'm going to jump to this other PowerPoint because I want to talk about, hang on, CJ Sim. Where is it? RN. Okay. So this is the 4 new slides with regards to your case studies. Okay, case studies are CJ Sim. So CJ Sims will support the development of the application of knowledge acquired to take the specialty exams. So what it's these CJ simulations will be you'll be applying your knowledge to practice. Okay. So when you go in and you've got 2 case studies, you'll go in, you open your case studies and follow the instructions. Okay. It will say open CJ Sim assignment. Okay. The process is similar to the old HESI case studies, but it's just, it's reworded. Okay. So, for your CJ Sim, for the 2 case studies, you have to access these through your module, through your link. Okay. If you try and go directly, and this is why you have to sign up for an account. If you try and go directly into NurseThink account, it's going to mess everything up. Okay. You won't be able to submit what you need to submit. Where if you go through the module, you'll be able to submit it and it will show up in the gradebook. Okay. So for CJ Sim, grades will transfer into the gradebook. Okay. You have to access it through Canvas course. So this is why everybody has to sign up. Okay. Only complete the case study for the link accessed. Screenshots must be submitted. That's different. Screenshots must be submitted as stated in the directions. Your name must show up.
So for the CJ Sims, I went on there to log in. It's your school email,
Yeah.
but I tried to do the password they gave us. So I just hit reset password and it sent me a new way to redo the password and sign me up.
Okay, so I'm so sorry. Where do I find this again?
It's in your email.
Oh, okay. Okay.
And then we posted, somebody posted the phone number in your email if you're having issues. Okay, discussion posts. Paper assignments will guide the development of professional goals relative to the profession. So, for example, this week it's identifying a vulnerable population in your community. Really important to community nursing. Next week, I give you a list and you pick 3 common childhood ailments and you talk about them. Okay, because if you're working with the kids in the community setting, you're going to have to know about childhood ailments, common ones, which I had to do with school nursing. Okay. Whoops, what did I just do there? Rubrics, you guys know about rubrics, follow your rubrics. APA, I sent you some information on APA format. I'm going through this quick because I want to get This is about exams. You already know this. They're timed. You can only complete it once. If you start the exam and don't complete, you won't get another opportunity. We'll talk about HESI down the road. We don't need to. You know about HESIs. They're usually given on campus. Most campuses are now on campus for HESI, 1 attempt. Sign date and time for the exam, 20% of the grade. This is remediation. We'll go through that down the road. We don't have to do that now. Okay. All right. Anybody have any questions? Anybody have any questions about that PowerPoint? I need everybody to be on camera. When I share my screen, I can only see a few people, and there's several people I can't see right now. Okay. Questions so far? What do I got going in the chat here? Oh, Danielle, where are you? Stay on after, okay, please. Thanks. Running to the bathroom. There's the phone number, if anybody needs it. For CJ Sim. Okay, let's jump to the. Okay, let me share. Okay. Oh, where are you guys? Helpful so far? Not too overwhelming? Oh, it's not overwhelming. You're going to enjoy this class, I promise. Community nurses rock. Community and public health nurses have kind of run the show for the last 3 years during the pandemic. All right? Community nurses rock. Their role has much been the awareness of the community nurses role, the public health nurses role has really increased over the last 3 years with regards to the pandemic. Okay, what do we want to do now? We want to do, okay. I need to go through a couple of announcements with you. Make sure you understand. Okay, can everybody see my screen? This is what I've posted to you guys. Dean Brown has posted 2 things. Opportunity to change your schedule. Everybody see that? Okay, let's see what your deadline is. This Friday, the 14th. Okay. I'm going to go to the beginning. Here's your etiquette email, your cover sheet, which talks about this. If you haven't open this because this talks about dropping if you need to drop. Okay, down here. Okay, course start today, withdraw by 9/1, end date 10/1. So that has some important dates. Okay. Let's see. What else do I? If anybody, let's see, welcome to class. You guys got that. Here's your welcome message from Dean Brown. Week 1 orientation part. So this is the PowerPoint I just covered. There's that. I gave you some APA resources because you're supposed to write your discussion posts and your papers in APA format. This one, if you struggle in math, please open up this math resource announcement. Professor Bogart, some of you may have her for pediatrics, has a YouTube channel. She does a wonderful, really layman's terms, back to basics on calculations. Okay, and here's the 3 handouts that go with her YouTube. Okay, so if you struggle with math, please review this before the first exam. Okay, it's excellent. I've had excellent feedback. I've been posting it. This is, I think, my 3rd term posting that. Here's another helpful email, how to be successful on discussion boards. Okay, so have a look at that. What I want to go through with you real quick is this. This is our week 1. Okay, so it talks about what this course will provide. I've kind of summarized that. Okay, it's a framework. I'm gonna provide you a framework to support our practice in community-based settings. right? So as I said at the beginning, now that you've demonstrated success and competence and the knowledge and the skills to care for your clients, now we're going to learn how to incorporate this knowledge, your skills you've learned, use of the nursing process, which obviously we use in the community setting, right? We're going to learn how to do that in the community. And the other thing with the community is our clients could be an individual. It could be a whole family unit. It could be a subset of the population in the community, say the homeless. So our clients can look very different. Where in the hospital, our patient is our patient, right? Well, your client in the community may be a whole family. Throughout the course, will be introduced and we'll explore your role, right? How do we collaborate within the community with the healthcare team? We talked about teaching. So we talk a lot about wellness promotion. We deliver care to the community in different environments, home, clinics, diagnostic-based care centers. We'll be caring in the community, we'll be caring for individuals with chronic illnesses. We'll be caring for individuals diagnosed with HIV. And as we talked about, lots of healthcare delivery with vulnerable populations. Okay, so we're going to learn how to take our nursing process, our ADPI, right? We're going to learn how to use the nursing process to apply critical thinking and problem solving skills, give you the resources you need to help promote health and wellness in the community. Because ultimately the goal is we want a safe, effective, or safe and healthy community, right? So each week I'm going to do a summary. I take this right from your syllabus of what you have to read. So this week's reading is your chapter 1, fundamentals, and see MedSurg. Just MedSurg is page 123. That's it. So I don't want to give you the whole PowerPoint for that chapter. It's one page. The one thing I want to point out is Canvas module reading. Has everybody figured out what that is yet? Okay. I'm going to jump over here. So in your reading, you're going to have book reading, and there's 3 books to choose from. Okay. But if it says Canvas module reading, and there's 4 bullets under here: introduction, levels, healthy people, introduction to vulnerability. Okay. This is where it is. Okay. So I'm just going to go to week 1, which is what we're in right now. This is where you find your Canvas. Now, if you've gone through your week 1 module, you've already seen it. Okay. This is your Canvas reading. So, some weeks you have it, some weeks you don't. This week it's a combination. There's book reading and there's Canvas reading. So if you go on to these, here's your intro to community nursing. Okay. That's part of your reading. If you go to next, it comes up, what is levels of healthcare prevention? This week has 4. Healthy People 2030. There's your reading on that. And then the last one is the intro to vulnerability. So you are responsible for Canvas readings. Okay, so there's your Canvas readings. And then I've also broken it out in your module to assignments. What's due this week? Okay, since we're here, let's look ahead to week 2. Okay, so next week you've got 2 topics that are in your module to read about, along with your other readings. Okay, so here's your week 2 reading. We cover all these common childhood ailments, which goes along with your discussion question, right? Make sense? So here's your introduction. So like for next week, you're in your intro to peds and maternity book. Look at it. You're only responsible for these pages, not the whole chapter. In your fundamentals, you are responsible for a couple of chapters: growth and development and adult chapter 12. And then your MedSurg book, 1 page, community care, 1024. Okay. Then it says, see Canvas course, school nurse and lead exposure. That Canvas course readings for week 2 are right here, school nurse and lead exposure. You following me?
I got a
Then here's-
question, if that's okay.
Yep, go ahead.
So I print, a lot of times I try to print it out. So I already printed out your week 1 blueprint.
Yep,
Do that go hand in hand with what you're clicking on? For
it
the-
does. It does.
So
The
if I do
blueprint
this-
is a summary.
Oh,
it-
just a summary.
It's a summary. Okay, so if you take a look at the blueprint, well, if you do your readings first, whether it's in the book or here, and then you look at your blueprint, it's the same information. It's a summary.
Okay.
It's not additional information you have to know. They go hand in hand. Make sense? And then when you get your study guide before the exams, that's a summary of the 3 weeks we covered. So it's not new information. So I'm really trying to connect the dots and do really focused and targeted teaching on what you need to know. Does that help?
Thank you.
Yeah, you're welcome. All right, where were we? What was I doing? Since we're in here. Okay, so everybody understands how to read a module, right? For week 3, you've got, well, let's go to the syllabus real quick. Let's talk about that. If you haven't looked at it, we've already covered quite a bit of information in the syllabus. Can everybody see this? What do I want to point out? Excuse me. All right. You can read through the student learning outcomes, SLOs, and your course objectives on your own. Okay. Hang on. There we go. Okay. Here's your books. You guys have a great resource package, by the way. Get in there and use those resources. I'm trying to get to, I'm trying to get to your books. I want to make sure everybody has their books. Where's our books in here? Right here. Here's your books. Okay, your fundamentals book, your med-surg book, your intro to maternity book, and your CJ Sim. Okay? That's the 4 primary resources we're going to be pulling from. And there's another one in here. If you struggle again with math, this calculating with confidence, calculate with confidence is an excellent math resource. Okay. We went through this in the orientation PowerPoint. This is everything broken down. Okay, your HESI, your assignments, we went through that. Lake work, we went through that. So this is for a 2-credit class. This is the out of class assignments, the hours we expect. Okay, which estimates 40 hours, which is 2 credits. Okay. And then here, I copy and paste all this information into your weekly announcements. So today, your content recording has to do with and your blueprint notes have to do with intro, and I highlighted each section on the blueprint handout. Intro to community nursing, levels of healthcare, healthy people, introduction to vulnerability. At the beginning of next week, we'll go over any questions you have from this week. Okay. And you've already seen all this. Here's all your readings. Okay. So your fundamentals reading, med-surg. You need to get on this healthy people website, and then see Canvas course, right? I just showed you where to find those in your week 1 module. And then over here, what's due? Discussion question 1. Your initial posting is due Wednesday night. Your peer responses are due by Sunday. Then as we move into next week, here's the blueprint concepts we're going to be covering. School nurse, growth and development, common childhood ailments, family nursing, family health risks. And here's all the readings that go along with it and the pages. Okay. And over here is what's due next week. In week 2, you have your discussion question 2, and we'll take quiz 1. Okay. You guys know how to read a syllabus. But look at all the things we're going to cover. It's kind of cool. All right. We've gone through 1 and 2, but look at what we cover. Special vulnerable populations. We'll talk about migrant farm workers, rural populations. Think about if you're a community nurse in the rural area. Okay. Homelessness, poverty. We're going to talk about pregnant, special vulnerable populations. We'll talk about pregnant adolescents, the LGBTQ population, mental illness. We focus on alcohol, tobacco, and other drug problems. And this is all the reading. In the middle column is all the reading that goes along with it. Then we're going to cover in week 5, hospice and palliative care, death and dying, faith and spirituality, ethics. Then we'll cover occupational health, environmental health, barriers to learning, health education. We'll also talk about infectious disease, prevention and control in the community setting, specifically HIV, TB, STDs. We do a section on bioterrorism and disasters. Home care, community resources, case management. Then we'll talk about some complex chronic illnesses that we will care for clients in the community with, cirrhosis, COPD, and so on. Okay, and then the last week we'll cover human abuse and violence, and then cultural influences on nursing, in nursing. So I guess I wanted to review that with you because you can see the wide variety of topics we're going to cover. Community nursing is not just a home health nurse going in to change a dressing, right? It's not just going in to make sure an elderly person has set up their meds, right? There's a lot to it. It's a big umbrella, huge umbrella. Okay. Syllabus, announcements, modules. I'll go to my to-do list. CJ Sam. Okay. That's an overview. What do you think after hearing that? What do you think? Are you super excited for this class now? Super excited. Just sit back and just enjoy. You may never work in it. Well, here's another good point. You may never work in the community, but you are always going to be working with community nurses, right? Say you're discharging a patient. Who do you have to get with to make sure everything's set up? The home health nurse, right? Think about school nursing. When I was in school nursing for over 20 years, I was working all the time with the public health department, whether I was reporting pertussis or reporting chickenpox, whatever. So even though you may not choose to work in the community, you'll always be working with the community, with community resources. I just had thought of something that was a really important point. Working in the community, what was it? I can't remember. So this is why you need all your prior classes, information, knowledge, to be able to take it into the community. Lots of different things go on in the community. Do you have a little bit better of understanding of what does go on in the community? Oh, I know what I was gonna say. Vulnerable populations. Whether you're taking care of clients in the hospital, out in the community, in long-term care facilities, you're always going to be working with vulnerable populations. Doesn't matter what setting it is. You know, when we talk about abuse and violence, you may be working with the victim, the perpetrator, a kid who's witnessed it. So it's important to understand that you're going to be, if you're in community nursing, you're responsible for making sure your community is healthy. We'll talk about how do you do a community assessment? How do you, let's say you're moving to a different state and you've just been hired as a community nurse in this community you know nothing about. And you're tasked with going in and how do you assess the health of the community? Is it a low-income community? Is it a community that has a high gang rate, violence rate, crime rate? How do you do a community assessment? How do you figure out what's going on? What do they need? What are the priorities? How do you partner up with, law enforcement, school personnel, religious leaders, and come together and work as a team to figure out how to make the community safer, healthier, more educated? So anyway, I'm going to stop there because I could just keep talking and talking and talking. Oh, I kind of made an executive decision. I know we're supposed to go till 40 after the hour. However, it's up to you guys, but I don't think we need a 10-minute break. And so we can finish up 10 minutes early. So I usually try and finish up by half after the hour. And so it's 3:20. I'm in Central Time, so it's 3:20, 4:25 for you guys. So how about 5 minutes of the gift of time to get a handle around getting your discussion question organized and done for Wednesday night? I'm telling you guys, this is it's a very manageable class. Just don't fall behind. There's no need to. None whatsoever. Okay. Questions? Has this been helpful? Is everybody really looking forward to this class now?
Yes, it's interesting.
It is interesting. It's very interesting. I mean, you think about it. You guys, you walk around your community day after day, week after week, year after year. How do all these ill clients get taken care of? How does all the teaching happen in your community? Who cares for the homeless? Who cares for the vulnerable populations? Who does all that? Somebody's got to do it, right? That's us. That's the community nurses. Whatever your role is, there's many, many, many different roles. The other thing we'll talk about, I don't know if maybe that's in the RN, but there's also another role is a faith community nurse. That's a really interesting role.
Is those the ones that go like overseas?
No, it's a community nurse, but they interconnect faith into the healing.
Oh, okay. Okay.
Yeah. So anyway, it was really nice to meet everybody. Really looking forward to this class. I do teach a couple of other sections. I teach two additional sections on Wednesdays, and then I teach one on Friday morning as well. So I've got four sections with community this term. Looking forward to it. I don't know if you can figure out, but I really love teaching. I really do. I've done everything. I started with military nursing early on, then was a director of women's and children's services at a big hospital in Denver. We did 600 births a month, ran that whole program, and then just finished 20 plus years in school nursing. And I always wanted to finish out my career in education. So I'm exactly where I want to be right now. I love teaching. I love working with students. It's just, you know what, it's giving back. Giving back. I was just, this past May, I was 40 years a nurse. I know I'm dating myself, but 40 years. So this is give back time for me. You guys are the up and coming group of nurses. And so if I can help you attain that knowledge and confidence, and nursing's a great career. Absolutely fantastic. So I look forward to working with all of you. Okay. So
Miss
if you need to,
Marble.
yes.
Yes, I wanted that. How does this CJCMs come into play as far as, is that just a resource or how do we do that?
You go in and sign up for an account because you're going to have to pull your case studies off there.
Okay, so this is where the case
Yeah,
studies come.
but there,
Okay,
right, but there are some activities. I went to my training last week. There are some activities on there that I like, and I may bring into class. I have to do some more research on it. But there, and in order for you guys to be able to participate in those activities, you have to have an account. Does that make sense?
yes, ma'am. Thank you.
Yeah. You're welcome. If anybody has any questions, please stay on. I need Danielle to stay on. I'm going to stop recording now. Thank you all for coming on time. I really appreciate it. And it was really nice to meet everybody. Okay.
Nice to meet you too.
Yeah, thanks. Thanks. I'm
Yeah.
looking forward to
Yeah.
this term. All right.
Thank you.
Have a great week. Have a great orientation week.
Thank you.
You're welcome.
Thank you.
You're very
Thank
welcome.
you.
You're welcome.